I've worked for the NHS most of my adult life now, and I've seen a hell of a lot of changes, and I think one of the biggest changes is the waiting lists at the moment are just, they're not achievable. They can't keep up with the pressure. I know from being a secretary and working on the front line with the patients how frustrated they are because the waiting lists are phenomenal, and when I do ring up other departments to try to chase them up, it's, you know, you're lucky if you're seen 6 months to a year, which in many cases is way too long. I think they're struggling, really. I don't think there's enough workforce to cover the workload. It's as simple as that. There's just so many referrals that are happening, and they just haven't got the manpower to keep up with it. Southampton General Hospital are really struggling, and we've actually been asked if we can refer elsewhere, then refer elsewhere, because they simply can't cope. I think the frontline staff at surgery particularly get it in the neck. We deal with a mixed bag of patients. A lot of them these days are anxious or stressed, or they turn to alcohol or drugs to deal with the day-to-day pressures. They can't cope, and inevitably, unfortunately, they do take it out on the frontline staff, especially when they don't get the answers that they want, and we have to tell them how long those waiting lists are. So yeah, we do get it in the neck. And you know, they deal with an awful lot down there. I'm glad I'm not on the front line, put it that way. It's unfortunate that a lot of people will turn to the GP in the first instance when they've got an issue, when a lot of the time they could actually talk to a pharmacist, go to a chemist, go to 111 out of hours, walk-in centres. We're trying to kind of steer a lot of patients that way, but you know, unfortunately for us, we're on their doorstep, so they just turn up. And it can be from something as minor as I need a stitch, where you could have had that done, you know, anywhere, to we've actually had patients in that have collapsed and don't need us at all. They need 999, but because we're there, they come to us. So if we could get in the patient mentality and actually get them to focus their mind on taking their symptoms elsewhere rather than just the GP, that would free up a lot of our time for what we need to be doing, really.